I want you to close your eyes for a moment and imagine something. Imagine waking up one morning and noticing that the center of your vision is slightly blurred. You think nothing of it. Maybe you're tired. Maybe you need a new prescription. But it doesn't go away. It gets worse. Slowly over months and years, the center of what becomes a dark smudge, a blank space, and you watch it grow, knowing that nothing your doctor is offering is going to stop it. Knowing that the face of your spouse, maybe your grandchildren, the sunset, the sunrise, all of it is starting to disappear, and you feel hopeless. There is nothing you can do. That is the reality of macular degeneration and retinitis pigmentosa, of optic nerve damage. These are just medical diagnoses, but they are a slow, terrifying theft of the most precious things a person has. And for most patients who receive these diagnoses, the medical answer is devastating in its own way. We can slow it, we can monitor it, we cannot reverse it. There is nothing more we can do, is what many of our patients are told. So today, though, I want to tell you something different. There is a doctor in Denmark named John Boel. He has spent his career doing something that conventional ophthalmology said couldn't be done, developing a specialized method of acupuncture designed specifically for degenerative eye conditions. Patients have traveled to this clinic from all over the world, from countries where they had already exhausted every medical option available to them. People who had been told there was nothing left, and many of them left with something they didn't have when they arrived: measurable improvement in their vision. Hope that had been taken from them, given back. The method is called AcuNova, and it is unlike anything in standard acupuncture practice. The points are very specific. The protocol is precise. It was developed through decades of clinical work and refined through thousands of patient treatments from around the world. It is not a general wellness approach. It is a targeted, specialized intervention for the exact conditions that conventional medicine has not a lot of tools in their toolbox or a lot of answers. I'm Dr. Rebecca Gibbons, acupuncture physician and registered nurse. I have been in practice for many years, and when I had the opportunity to study this method directly, to understand the mechanism behind it, and to see how it works and what results it produces in real patients, I knew immediately that it could mean what it could mean for the people here in the Gulf Coast who are losing their vision and have been told there is nothing left to try. That is why this series exists. So I want to stay with the emotional reality of this for a moment, because I think it gets clinical very quickly in medical settings, and the human experience of these conditions deserves to be described and named. Vision loss is unlike most any other medical experience. It is invisible to the people around you. It is progressive. You watch it go, you notice the things you can no longer do, you stop driving, you stop reading your own mail, you hold your phone inches from your face, you start planning your life around what your remaining vision will allow instead of what you actually want to do. And perhaps the hardest part, you grieve things that haven't fully gone yet because you know where this is heading. Macular degeneration doesn't stop on its own. Retinitis pigmentosa doesn't stop. And every morning you wake up wondering if today is the day you notice it's a little worse than yesterday. The fear is something we take very seriously. It is not a side note to the diagnosis. It is not the center of the experience, or it is the center of the experience. And that's why what John Boel does matters so much, and why having access to AcuNova treatment here in Pensacola matters. Because for the first time, there is an answer to give these patients that isn't just monitor and wait. There is something more that we can do, and in many cases, it works beautifully. So I know what some of you are thinking. Acupuncture for eye diseases, how does that work? And the obvious question, do the needles go in my eye? Which I will quickly answer no to that one. No needles in the eye. I will be more specific though about the first two questions. Physiologically, the retina is one of the most metabolically demanding tissues in the entire human body. It requires constant high levels of oxygen and nutrient delivery just to function. And many of the degenerative eye conditions we're talking about, macular degeneration, retinitis pigmentosa, diabetic retinopathy, involve at their core a failure of the microvascular supply to the retinal tissue. The tiny blood vessels that feed the photoreceptors become damaged and insufficient or dysfunctional. And when those cells are starved or what they need, they begin to die. What AcuNova treatment does through a precisely mapped system of acupuncture points developed specifically for this purpose is it stimulates the neurological and vascular pathways that supply the retina and the optic nerve. It promotes increased circulation to the tissues that have been oxygen deprived. It reduces inflammation in and around the retinal environment. It supports the survival function of the cells responsible for your vision. What AcuNova treatment is designed to address is improve the microcirculation to the retina and the optic nerve. It reduces inflammation in the ocular tissue that drives degeneration. It supports the survival and function of photoreceptor cells, and it stimulates neurological pathways involved in visual signaling processing. So it also slows, or in some cases completely stabilizes, the progression of the degenerative conditions. This is not mystery. This is not faith healing. This is a coherent physiological explanation for why this works. And it has been validated through thousands of patient treatments at Dr. Boel Acupuncture in Denmark, and by practitioners trained in this method around the world. I will emphasize that the needles used in AcuNova treatment are not placed in the eye. The points are located in other areas of the body that, through specific neurological pathways, influence the vascular and neural environment of the retina and the optic nerve. Most patients find the treatment completely comfortable and are surprised by how gentle it actually is. So let me walk you through the conditions that AcuNova protocol is designed to address. If you or someone you love has received any of these diagnoses, please stay with me. So the first diagnosis I want to discuss is macular degeneration, both dry and wet AMD, the most common degenerative eye condition in adults over 50. AcuNova treatment focuses on improving retinal circulation and supporting the health of the macula, the central area responsible for detailed vision. Our next diagnosis, retinitis pigmentosa, a genetic condition causing progressive degeneration of rod photoreceptors leading to tunnel vision and eventual blindness. One of the conditions where conventional medicine has really not a lot of answers, and one where AcuNova has shown some of its most meaningful results. Now let's talk about glaucoma, which is characterized by elevated intraocular pressure that damages the optic nerve. AcuNova addresses the vascular supply to the optic nerve and neurological pathways involved in pressure regulation and nerve function. Diabetic retinopathy, retinal damage caused by chronically elevated blood sugar, the leading cause of blindness in working age adults. AcuNova addresses microvascular damage to retinal tissue alongside systemic blood sugar support. Optic nerve atrophy damage to the optic nerve from various causes: injury, inflammation, pressure, or reduced blood flow. AcuNova targets the vascular and neurological supply to the optic nerve directly. Stargardt disease, a juvenile form of macular degeneration presenting in childhood or young adulthood. It is rare and devastating, and one where conventional medicine offers very little, unfortunately. But AcuNova has produced meaningful results internationally for this condition. Other retinal conditions, including central serous retinopathy, retinal vein occlusion, and other conditions involving retinal function and vascular health. If your diagnosis is not listed, call us. If I didn't go over it, we still may be able to help. Next, I want to discuss with you the treatment format. There's something important to understand about how this treatment is delivered because it's different from a standard acupuncture schedule. And I want to explain why. Because once you understand the process and the reasoning, it makes complete sense. So the AcuNova protocol is delivered as an intensive. We do 2 treatment sessions per day over 10 treatment days, which we schedule across 2 weeks. That is a significant time commitment. I understand that. And it deserves a straightforward explanation of why we do that. The retina and optic nerve are among the most demanding tissues in the body, as I previously said. But the therapeutic window for treatment, the period during which concentrated intervention can produce meaningful change in these tissues, requires sustained cumulative stimulation. 2 treatments per day over 10 days creates a level of therapeutic momentum that simply cannot be achieved with the same number of sessions spread out over months. Think of it this way. If you want to move something heavy, you'd apply sustained force, right? Stopping and starting doesn't accomplish what continuous effort does. That's the logic behind the intensive. It is the format in which AcuNova produces its best results. So what does it look like? So we, like I mentioned, 2 treatment sessions per day, 10 treatment days total over 2 consecutive weeks. It's comfortable. It's non-invasive needles, which are not placed in the eye. Patients traveling from outside the area are welcome. We can do a consultation over the phone. And you follow-up protocols are available after the initial intensive. So we'll discuss that in the consultation as well. So if you're watching this and thinking about 2 weeks, I want you to sit with this question. What is 2 weeks of your time worth if it has produced meaningful improvement in your vision? If it has slowed something that has felt unstoppable? If it gave you back even a portion of what this condition has been taking from you? Those questions are worth sitting with, honestly. And if the question is that it's worth a conversation, that's exactly what I am here for. If you are out of the Pensacola, Florida area or the Panhandle area, then give us a call and I'll put that information in the comments and we can set up a over the phone consultation with you. In the next episodes that follow, we are going to go deep into each of these conditions individually, which is actually happening in the eye, why conventional treatment runs out of answers, and what AcuNova can realistically offer, and what results look like with our real patients. We're going to be thorough, and I'm going to be honest. So if you or someone you love is dealing with macular degeneration, retinitis pigmentosa, glaucoma, diabetic retinopathy, or any degenerative eye condition, and you have been told that there's nothing more that can be done, I want to invite you to a conversation before you accept that. Call us at 850-530-1028, and my assistant will schedule you for a consultation. You and I will sit down together or over the phone and review your diagnosis and your history. I will give you my honest clinical assessment of whether AcuNova Intensive is likely to be beneficial for your specific situation. You can learn more about our practice and these treatments at awpensacola.com and subscribe so you don't miss the next episode where we go deeper into macular degeneration specifically. what's actually happening in the eye and why conventional treatment often falls short, and what AcuNova treatment does for the macula. I'm Rebecca Gibbons. There is more possible for your vision than you have been told. And thank you so much for giving me your time. Have a great rest of your day.